Good morning and good afternoon, everyone. My name is Maisha Hutton, and I'm the Executive Director of the Healthy Caribbean Coalition. And I'm delighted to be your moderator today for this webinar, a conversation on the urgency of introducing front of package nutrition warning labeling in the Caribbean. This webinar is being hosted jointly in partnership with PAHO, the OECS Commission, and Unicef as part of our recently launched campaign, Now More Than Ever, Better Labels, Better Choices, Better Health. We have put together a wonderful panel of experts today who will provide compelling evidence in support of octagonal front of package nutrition warning labels. Before we get on to the welcome and opening remarks, a few housekeeping matters. Please use the Q&A function for your questions. And with that, I would like to introduce our first speaker, Sir Trevor Hassell, President of the Healthy Caribbean Coalition, to deliver the first set of welcome remarks.
So thank you very much, Maisha. And let me say what a tremendous pleasure it is for me to join you in welcoming everyone to today's webinar, which is being held in support of World Health Day 2021 with its theme of building a fair, healthier world and an urgent call to work together to tackle health inequities. The issue of addressing health inequities is one that resonates well with the HCC, for it's an approach highlighted in our recent publication, Transformative New Agenda for the Prevention and Control of NCDs in the Caribbean. In that report, a framework for multi-sectoral collaboration in accelerating NCD reduction based on principles of equity and human rights to enhance the region's human security and human capital is laid out. And we highlight the need for, and I quote, bold approaches to NCD reduction to address the inequities, health system gap, and implementation deficits that COVID-19 has laid bare globally and regionally, end of quote. The extent of the pre-COVID-19 health and socioeconomic burden of NCDs in the Caribbean is well known, reflected not only in poor individual and population health, but also in reduced productivity and delayed sustainable national development. COVID-19 has shown the significantly increased vulnerability to COVID-19 of people living with NCDs and revealed inequities and shortcomings in implementation of comprehensive national responses to NCD prevention and control. This is particularly evident in the area of food consumption, where the overconsumption of widely accessible, cheap, heavily marketed, poorly labeled, processed and ultra-processed packaged foods, high in sugars, salts, and fat, contributes to unhealthy diets and lead to some 60% of adults being overweight, to high prevalence rates of hypertension and diabetes with associated significant ill health, and 40% of premature deaths due to NCDs in the Caribbean. Against this background, 3 years ago, Caricom leaders made commitments to implement front of package labeling as a key measure to tackle the unsustainably high burden of NCDs in the Caribbean. And CrossQ was tasked with developing a front of package nutritional warning label standard. This process has been supported by technical assistance from PAHO in their capacity as one of 2 key health agencies for the region, whose experts have unequivocally recommended the octagon-shaped front of package warning labels and the PAHO Nutrient Profile model as the most effective nutritional front of package labeling system to allow consumers to quickly, easily, and correctly identify packaged products high in sugars, fats, and or salt. The HCC, together with a wide range of stakeholders from across the Caribbean, including academics, nutritionists, and dietitians, and physicians strongly supports the octagonal front of package nutrition warning label standard and its eventual adoption by Caribbean countries. Our campaign will continue aimed at achieving this objective, which is expected to contribute to the health of the people of the Caribbean. Thank you.
Thank you, Sir Trevor. I would now like to invite Dr. Didicus Jules, Director General of the OECS Commission, to speak. I think we were having some technical difficulties, so let's go ahead with Dr. Alois Kamuragie of Unicef. Thank you, Dr. Alois.
Thank you. Masha, can you hear me?
I can hear you.
Good morning, everyone. I would like, first of all, on behalf of Unicef, to commend HCC, the Healthy Caribbean Coalition, for the leadership they demonstrated over the last years in using evidence to advocate and mobilize the public around the fight against the first killer across the Caribbean, the non-communicable diseases. We are here, of course, to have an urgent conversation about a critical tool that can help us achieve a healthier, more thriving region for all of us, and especially for our children, the octagonal front of package warning labels. These labels may sound small, but they have a massive significance. We want them placed on foods with high in sugar, fats, and salt to help us make informed choices about what we eat and what we give our children. It's a difficult fact to digest, but a lot of the food our children eat is making them sick. We have a true health crisis on our hands here, as 1 in 3 children in the region is overweight or obese. These rates are among the highest in the world and are leading to a growing number of children with early onset non-communicable diseases. These diseases such as hypertension, high heart disease, and diabetes are ravaging our populations and are now the leading cause of mortality and morbidity. This is a human right and specifically a child rights issue. The Convention on the Rights of the Child recognizes that all children are entitled to inalienable rights, including the right to healthy food and adequate nutrition. This means that the duty bearers, starting first and foremost by the state parties signatory to the convention, have the obligation to ensure that children are protected from unhealthy food environments that undermine their right to healthy food and adequate nutrition. It is a daunting prospect, but we are not powerless. There is much we can do to vigorously challenge a food environment which damages our children and blights their future. They should be given the very best start in life, the very best opportunity to thrive and achieve their full potential. Caricom member states are currently voting until 14 April to adopt a Caricom regional standard, which incorporates front-of-package warning label specifications. Mounting international research and a recent study in Jamaica show that octagonal front-of-package warning labels are the most effective. A front pack food labeling is effective when it is simple, eye-catching, conspicuous, does not require mathematical skills, takes little time to interpret. This is the way forward, alongside a broad range of other interventions, including those aimed at raising awareness of children's internationally recognized right to healthy food and adequate nutrition. So let's take this opportunity to lobby our leaders to make sure we are ahead and to challenge them to do the right thing. We need action, and we need it now. Thank you. Back to you, Maisha.
Thank you, Dr. Kamaragier. Dr. Kamaragier is the UNICEF representative for the Eastern Caribbean area. Thank you. Now we have Dr. Didicus Jules, who is the Director General of the Organization of Eastern Caribbean States. Dr. Jules, the floor is yours.
Thank you very much. Apologies because I had somehow gotten logged off. For many years, we've known that non-communicable diseases are a leading cause of death in the Caribbean region. Death rates from this epidemic are among the highest in the Americas. And we have very high rates of obesity, which is increasing among our children. According to a PAHO study done between 2006 and 2016, 70% of all deaths worldwide were due to NCDs. The 4 NCDs of cancer, heart disease, stroke, and diabetes accounted for between 40% to 67% of all deaths in the OECS countries studied during the period 2006 to 2017. The COVID-19 pandemic has brought home to us the inescapable importance of a healthy lifestyle to our ability to survive both NCDs and infectious diseases. The virtual cessation of trade has resulted in higher food prices and a slowdown of imported food in the region. But on the positive side, we have also become more sensitive to the reality that we are what we eat. And even at the domestic level, we are growing what we eat and eating what we grow. Highly processed foods that are high in sugar, salt, and fats have proven to be exceedingly dangerous to our health because they weaken the body's immune systems. The OECS Commission is very pleased to stand firmly with the Healthy Caribbean Coalition in taking a stand against these damaging products. CROSSQ, the Caribbean Regional Organization for Standards and Quality, is leading a process that is being managed through the bureaus of standards in the member states to introduce the front of packaging labeling, as Alois described, in the Caribbean region. Front of package labeling is a policy tool for prevention and management of non-communicable diseases by making clear which processed products are high in salt, sugar, and fats. It seeks to bring this to consumer attention by having an octagonal warning label placed on the front of all manufactured food products. We are seeking to make these labels mandatory on these products so that it is easy for consumers to know which products are dangerous to their health. We have a right to know what the food we consume contains in order to exercise informed and healthy choices. COVID has taught us that our health is our greatest wealth and that unhealthy lifestyles pose a heavy, costly, and unsustainable burden on our domestic as well as our national budgets. The OECS Commission therefore joins hands with PAHO, the Healthy Caribbean Coalition, and Unicef in encouraging public consultations on front of package warning labeling. And we urge Caribbean manufacturers to also see the huge opportunity for them to also adopt these standards and position themselves with products that are reflective of healthy eating. Because for our manufacturers, there's a global niche for healthy foods, which they can profitably occupy by joining these efforts. Now more than ever, better health labels enable better choices, which create better health. And we urge our governments, consumer rights organizations, health associations, and everyone who is conscious of the immense wealth that is good health to join this campaign. We are fully on board at the OECS Commission, and we will work assiduously to that aim. Thank you.
Thank you, Dr. Jules, for those excellent remarks. I'd now like to invite Dr. Anselm Hennis, who is the Director of NCDs and Mental Health at PAHO, to provide his remarks. Dr. Hennis.
Yes, good morning. Morning to you, Maisha. Good morning, all. It's indeed a privilege and pleasure to me to welcome you to this webinar, a conversation about the urgency to introduce front of package warning labeling in the Caribbean that PAHO is pleased to co-host with the Healthy Caribbean Coalition, the Organization of Eastern Caribbean States, and Unicef. In 2007, Caricom heads of state and government met in Port of Spain, Trinidad and Tobago in a truly unprecedented event. It was the first time that the region's political leadership had convened on a health matter, and this health concern was then causing the deaths of 7 in every 10 persons in the Caribbean subregion, and challenged the capacity of health systems, but also threatened to reverse economic and social development in the Caribbean subregion. This health threat was the non-communicable diseases, as you have heard. They include cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. The resulting declaration in Port of Spain, uniting to stop the epidemic of chronic NCDs, elevated non-communicable diseases to the global stage under the leadership of the Caribbean, and led to the first high-level meeting of the United Nations General Assembly on the prevention and control of non-communicable diseases in 2011. A decade later, NCDs still remain the leading causes of morbidity, mortality, and disability in the Caribbean, as you have heard. The situation has worsened during the current COVID-19 pandemic, as persons living with NCDs are at greater risk of becoming severely ill and dying from COVID-19. Additionally, we are witnessing disruptions in essential healthcare services, as well as the impact of lockdowns and diet and physical activity, all serving to worsen outcomes for persons living with NCDs. Regrettably, there has been little progress in implementing interventions to address obesity. The Caribbean subregion now has the highest rates of childhood overweight and obesity in the entire region of the Americas. Unhealthy diets, excessive and critical nutrients, namely sugars, fats, trans fats, saturated fats, and sodium, are major contributors to obesity and the NCD burden. And the chief source of these nutrients is processed and ultra-processed food products. Supermarkets are crowded with thousands of packaged items, and shoppers spend only a few seconds selecting an item. Too little time to find out whether the product is good for their health or contributes to high blood pressure, high blood sugar, overweight, and obesity, 3 conditions which are responsible for almost half of all deaths in the Caribbean. There's therefore an urgent need to adopt policy measures that make nutrition information more available and accessible to consumers. As you have heard, front of package warning labeling is supported by strong regional mandates, which not only include the 2007 Port of Spain Declaration, but also the communiques of the 37th and 39th Conference of Heads of State and Government, And you have obviously heard also, we've had a very clear discourse about the work and leadership of CrossQ in this space. As you'll hear in the presentations today, there are several front of package labeling systems. A large body of scientific evidence has consistently shown that the octagon-shaped front of package labeling system is the best performing labeling system. And the randomized clinical trial, and I will point out that this is the most rigorous form of scientific investigation that was recently carried out in Jamaica, also indicated the superiority of the octagon-shaped front of package warning label. As a result of this study, there are now data of the highest quality available in the Caribbean region and front of package labeling systems for the very first time. It is a public health priority that we must make nutrition information more available and accessible to consumers who have the right to know through effective front of package warning labeling. A decade after the declaration of Port of Spain, the Caribbean continues to be the sub-region of the Americas with the highest rates of premature mortality due to non-communicable diseases. There is, however, a unique opportunity for the Caribbean region to realize the vision of the Declaration of Port of Spain by adopting healthier behaviors, avoiding risk factors that are detrimental to our health, public health, and sustainable development by adopting front of package warning labeling as a tool that will help Caribbean people make healthier dietary choices the easier choice. I'd like to thank our distinguished guests and participants for taking the time to be part of this conversation and look forward to the full engagement of all those who are present. Thank you so much.
Brilliant, Dr. Hannes, thanks very much. And thank you all for those stellar opening remarks. I would now like to invite everyone to listen to Dr. Fabio da Silva Gomez, who is the advisor in nutrition and physical activity and NCDs and mental health at PAHO. Fabio, please go ahead.
Thank you very much, Maisha. I believe you can now see my slides. Let me just open it. Yes. So thank you very much for this opportunity. And I think that the first, I'm going to go straight into the presentation because there's a lot of evidence to cover in this short time. So the first thing that is really important for us to understand when we're looking into the contribution from the package labeling is how and what are the greatest burden of diseases that we have in the region. And as you can see, almost half of the deaths in the Caribbean in 2019 were caused by high blood glucose, hypertension, overweight, and obesity. And that doesn't mean that besides an impact of health, we also have other impacts that goes beyond health because we're affecting the quality of life of people. So it's been estimated that in 2019, 4.7 million years of quality of life were lost in the Caribbean, if we're summing the premature deaths as well as the time that people were ill because of these risk factors. They could not work, they could not play, they could not go to school, or they could enjoy the life the best way they could. So we're losing and impacting society in different dimensions, not only health. And for these reasons, the purpose of front of pack labeling is to help consumers identify products that are in excess of critical nutrients that are associated with these NCDs. So high blood pressure, high glucose, high blood pressure, and overweight and obesity are associated with excessive intake of sugars, fats, including total saturated and trans fats, as well as salt and sodium. So if we need to meet that purpose and we need to find the system that can best do that. The other thing is that we need the system to be easy and quick. And this is based on Nobel Prize Economic Science winner evidence and investigation that they've conducted and since the 1970s to demonstrate that consumers do not engage in extended cognitive effort. They minimize both error and effort when they're in their purchase situations. And this is even more important when it comes to repetitive purchase situations, which is the case of food. We don't buy a car every day, but we do buy food sometimes every day, sometimes every week, but at least once a month. So consumers won't spend much time or effort in taking the decision when it comes to food purchases. And what we want from these front of pack labeling systems is for them to be easy, quick, for them to be relevant and make the information, the nutrition information, more relevant and useful for the consumer. And finally, to change the intention to purchase products, or the decision or actual purchases of the products, so they improve their purchase decisions and their diets and ultimately their health. And what the warning systems have been, the evidence has been demonstrated, the warning systems are the ones that perform best in meeting these purpose, and have best performance in meeting that purpose. And so I'm just highlighting two reviews here. On the left, you have one review that demonstrated that the front of pack warnings that were visually attended to by consumers. They are easy to understand. They help consumers identify products high in nutrients. They discourage purchase, and this coming out from studies from Latin America, the US, Europe, New Zealand, Australia, different countries. On the right hand side, you see a forest plot. What we want to see here, you see on the bottom, is that when you go to the left, you favors the labeling. When you go to the right, you favors no labeling. And what you want to see is that these lozenges on going to the far left. And if you look at all the systems here, we have the warnings, we have the health star rating that is voluntarily used in the New Zealand and Australia. You have traffic lights voluntarily used in the UK, Nutri-Score voluntarily used in some countries in Europe, and then you have the effects up front, which is just a miniature of nutrition facts. And if you look at the summary of these effects, the only system that can change, and this is here, they're looking at how the change in the purchase of products affect the amount of sugar purchased by consumers. And the only system that could change that effectively was a high in sugar. And this is a meta-analysis of several studies that were conducted by a group on the University College of London. There's more evidence, more questions and answers that you can access in this publication. Also on the PAHO website, you see above paho.org and topics front package labeling. Now shows some examples of studies that demonstrate that warning systems are easier, quicker, more relevant, more useful, and are have a better, can change more intentional decision and the actual purchase. This study measured the time that people took to identify the front of package in the front of package label on the front of the package. And as you can see, the GDA compared to the traffic light and the warning, you see that the amount of time in milliseconds here is significantly lower compared to the traffic light and the GDA. Again, the relevance is also important because there's other things on the front of the package that we don't want, we want to be less relevant than the information because they're bringing people to buy sugary products or products excessive in sodium. So we don't want cartoon characters or fruit drawings to be relevant in products that are excessive in sugar or sodium and fats. So what you want to see in this graph here is lower bars under cartoon characters and for fruit drawings, and higher bars for front of pack nutrition information, which means we want cartoon characters to be less important, and we want fruit drawings to be less important, and nutrition information to be more important. And that's what the study shows. When you have the warning systems, the bars for cartoon characters and fruit drawings are low, which means they're less important when you have the warning system. And the information, the nutrition information becomes more relevant, more important for the decision. This other study also, a crossover trial, randomized trial, identified how the warnings compare to traffic light in terms of the trustworthy decision, quickness and easiness of the understanding. And you can see that all bars are significant, the differences are all significant. So the warnings were more truthful and trustworthy. They helped more people decide what they should buy. They were quicker to helping them, and they were easier to understand. Now, there's also a question about within the high-end systems or the warning systems, if other systems like this magnifying glass would perform differently from the octagonal warning systems. And what the evidence has demonstrated, and this study was done in Australia, Canada, UK, and the US, that the magnifying glass is not able to change the correct answer about the excessive amount of saturated fat sugars. So when this system was applied, there was no improvement from the control or having no front of pack labeling. And when you have the octagonal warning, almost triple the chances of people having a correct answer about the excessive amount of saturated fats, and almost double that amount of you have 60% of improvement of getting a correct answer for sugars in this study. This other study was done in the US, and they've tried different warnings, different sorts of warnings, some with just saying that it's high in sugar, and some having health warnings with more elaborated texts. But what I wanted to draw your attention here is also not only compare the messages, but also the shapes. And again, the octagon shape was compared to the rectangle shape, and the perceived message effectiveness was improved by 8% just by changing the shape. Again, the octagonal shape performed better and improved the effectiveness of what we want to achieve in informing consumers. The other reasons that there's implicit dose response when you're using the octagonal warnings, because you have several icons for each of the nutrients. When you have one single icon like the magnifying glass, and you can compare these products, once you have when you have the octagonal warnings, the more nutrients these products is high in, the more you occupy the size of the front of pack surface. So, and the more you occupy that, the better is the response from the consumer, because there isn't a dose response implicit in the system. So, and the other thing is that it's harder to compare if two products are, for instance, that have the same magnifying glass, but they have two high in nutrients, and then the other have three. When you're using this icon, because it's just, it's just the same size, but then it's easier to compare if you have the octagonal warnings, because you have more or less area of being occupied on the front of the package. Now, apart from the body of evidence that we have in several countries that already indicated to us that the octagonal warnings perform best to meet the purpose that we're looking for, we've also, in partnership with the Ministry of Health and Wellness of Jamaica and University of Technology, Jamaica, developed this randomized controlled experiment that allows us to randomize not only people for different systems, but it also took care of randomizing the products, categories of products. The order of the products were shown to the participants, but also the order of the products within each category. So we had 4 groups here. One control group, we just saw this miniature of the nutrition facts on the front of the pack, which is called the nutrition facts up front. We have the traffic light labeling as voluntarily applied in the UK, and the magnifying glass, which was one proposal that was being discussed as well in the Caribbean and proposed by some groups, and then the warning labels as we see here on the screen. And for the 4 groups, they all saw exactly the same product except for the front of pack labeling system. So that the only difference was that, and that's why the study is so robust and so well controlled for any sort of bias. And the results, what the result shows us is that the octagonal warnings were the only one that allowed consumers to improve their capacity, their chances of correctly identifying a product as are the least harmful option that they were presented with. And in this case, as you see on the left, the octagonal warnings were able to double the chances of people identifying the least harmful option more often. And on the right-hand side, we also asked them if they would buy one or another product, And again, almost double of the amount of chances of people choosing to buy more often the least harmful option or none of the options if the octagonal warnings were used. So in both cases, selecting the least harmful option or intending to buy the least harmful option, the octagonal warning performed much better. And then in this final analysis, we also check how correct and how often people got the correct answer in terms of the products being high in one or another nutrient. And as you can see in the black part of the bars is the number of is the proportion of people that got the answers correctly 4 times, which is the maximum possible number of correct answers they could get. And the more, as you go from controlled traffic light magnifying glass, you see that octagonal warnings get the highest percentage of people that got the maximum possible number of correct answers. And on the bottom and light green, you see the number of the proportion of people that get 0 times correct answer, and this is very high on control, and it's the lowest at the octagonal warnings. Again, demonstrated it performs much better. Then a very brief summary of post-intervention studies. This study was done in Uruguay 10 days after the implementation. And consumers, while entering the supermarket, they were offered to use an eye tracking device, so we knew where they were looking at and how they were taking the decision. And this study demonstrated that we've done in partnership with Unicef, the University of Uruguay, that almost 60% of the participants have changed their decision as they were exposed to these octagons 10 days after the implementation. In Chile, the amount of reduction of purchase of high-end beverages is also really impressive, almost 1/4 reduction. We have 23.7% reduction for the overall sample here, but also you see in different education groups, there's almost or at least 20% or almost 20% reduction in the purchase of high-end beverages that was reduced. And finally, after one study that was coming from Mexico that also adopted a similar system compared to what we have in the cross-Q standard right now, and has estimated not only that the obesity will drop by around 15% in 5 years, but also will save Mexico an estimated $1 billion on obesity costs. One important point to close this is that the front of pack labeling is a system. It doesn't work if you just have the best performing graphic system, but you don't have a nutrient profile model and thresholds that can put this front of pack labeling system in the products that are really excessive in these nutrients. And this is important as and I like to use this example. It's like, not if your ad use the warning labels, but you don't use the nutrient profile model of PAHO that is linked to WHO intake goals. It's like defining where the stop signs in the neighborhood should be placed. You ask the traffic engineer how many stop signs it should have in that neighborhood, and then he says you have to have 10 stop signs, but then someone says, no, let's just have 5 stop signs, and 10 is too much. Well, the stop signs will work where they are, but the road safety of that neighborhood will not be effectively protected and effectively working, because there's many intersections that will be not having that stop sign. So it's very important that all products that are excessive in these nutrients, according to the nutrient profile model of PAHO and WHO, are labeled as such. And the nutrient profile model is based on the population intake goals of WHO for all these nutrients. So all these numbers comes from the guidelines, which is done based on the most rigorous process of defining, and it's applied for all guidelines of WHO. And actually, this approach that PAHO has used to increase the capacity of people to meet the WHO intake goals using this nutrient profile has now been expanded and growing and moving into other WHO regions. So in the Southeast region and all the countries that are developing, all the regions of WHO that are developing their nutrient profile model, they're also using the same approach that PAHO is using. So this is in Southeast Asia, in Africa, and they're actually adding even more rigorous threshold for sugar. For instance, in the case of sugar sweetened beverages, they're moving into lower than 5% as the nutrient intake goes, and benefit could be even higher if you further restrict. So just to show how it is being expanding throughout the world. And one of the arguments that sometimes we hear is, well, there's a lot of products that are going to have warning labels. So what we say is that even for, if we take the example of machinery that could rip a hand off, 100% of those machines have to have a warning to warn people about that. So if the product is high in sugar or if it's high in sodium, we have to warn people about, we have to provide that information. We cannot take and decide how much products we have based on our thinking that more or less products should have it. We should be based on the recommendation and on the evidence. And on the other side, it's really important to notice that it's not a lot of products, as some people say, that would be subject to the warnings. And this is based on this USDA database. They have nationally, internationally products that circulate not only in the US, globally. And this database that has more than 350,000 products. And what you can see here is just 9% of those products in this database would be even subject to the application of warnings in the nutrient profile model, because the other 91% would be of fruits, vegetables, poultry, meat, fish, and all the varieties of fruits and fishes and pulses that we have in different countries. So most of the products will not be affected. And finally, why these products and why we're focusing on ultra-processed products and processed products? Well, the scientific literature on ultra-processed is exponentially growing, as you know, and now we're at the stage of doing systematic reviews. And actually in 2020, there was 8 systematic reviews demonstrating the impact of ultra-processed products on health. And this is how ultra-processed food intake increases all-cause mortality, cardiovascular disease, cerebrovascular disease, depression, overweight, and obesity. Even in low-energy diets, it also reduces. Large cohort studies from France, UK, Spain, demonstrating with large number of people for a long time that this is also increasing the risk of death. And even when you replace that ultra-processed products with the same amount of energy, so isocaloric replacement, that people eating the same amount of calories, but you're moving from ultra-processed to unprocessed products, as you see on the right, you reduce the risk for death. But one of the things you could ask then is, why then also target processed products if the ultra-processed products are really the main problem? Well, if you see the replacement of ultra-processed food with processed food, you don't see that reduction that we see when we replace ultra-processed food with unprocessed and minimally processed foods. So processed foods are also, if they're excessive in sugar, sodium, fats, they should also have a warning label to let people know they're excessive. And as we know from many different systematic reviews, canned fruit, preserved vegetables, they have the capacity, they don't exert the same effect of fruits and vegetables. They increase the risk of all-cause mortality. They increase the risk of cancers. They increase the risk of cardiovascular disease. So it's also important to inform people about that. And I'll just end, because we usually start with why we're here, and we sometimes forget why we're here, and the need for us, and what is the inaction means when it comes to taking this contribution of front-of-pack labeling to help people improving their health. And we know that by the time that we end this event, we'll probably have 30 people more dead if inaction is sustained. So I just wanted to end with this sense of urgency as this session requires us. Thank you.
Thank you, Fabio. What a powerful presentation. The evidence is so compelling. From the Jamaican study to the projected impact on costs and obesity in Mexico. Fantastic presentation. I'm now going to turn over to Sir George Elaine, who is the Director Emeritus of PAHO and also the patron of the Healthy Caribbean Coalition. Sir George is going to moderate a panel, and I'm handing over to you, Sir George. Thank you.
Thank you very much, Masha. We are 15 minutes behindhand. Should I continue for 15 minutes longer?
I think let's go 10 minutes longer, Sir George, and see how we are then. Thanks.
Good. Thank you very much. Well, thank you very much. Let me congratulate all of you who've spoken already. That was quite a tour de force, Fabio. This is a conversation, and it's an urgent conversation. We've had conversations before, and the last time we met as a group, we talked about the aspects of equity, aspects of the rights that people have to information, and we're going to continue the conversation today. We know that this is World Health Day, but this kind of theme is important every day, not only on World Health Day. So I'm looking forward to the panel elaborating and explicating, perhaps on a wider basis, why this conversation is urgent. And I would like to urge those who are listening in to think that this is not a conversation should end today, but as a conversation should go on and on and on and on until we have the desired objective. My first panelist is Ms. Nicole Foster, who is the Deputy Dean for Academic and Student Affairs at the Faculty of Law. Nicole is an expert in these various areas, but I'm going to focus on one aspect of her expertise and ask her, how will front of package warning labels, will it really represent a barrier to free trade? We heard this thrown up all the time. It will be a barrier to free trade. Can you debunk that myth?
Thank you, Sir George. So the response is that that's not the right question in the sense, or the right challenge, because the question is it a type of barrier that is allowed within the trade regime? And the fact of the matter is that, so front-of-pack labeling, and there are many other different schemes as well, labels generally tend to be seen as barriers to trade because they potentially will impact how much imports will come in. But what is important to bear in mind here is that the World Trade Organization, which is of course the premier organization in this area, their agreements allow for technical barriers to trade, provided, and this is under the Technical Barriers to Trade Agreement, and in particular Article 2, provided that those barriers are not applied in a manner that amounts to arbitrary or unjustifiable discrimination or disguised restriction on international trade. And that's from the preamble, which recognizes, in fact, as well, the state's right to implement the level of protection that they deem appropriate, while, you know, taking account of the need not to be discriminatory, etc. But then that's just the preamble, but it gets even better. Because when we go to the substantive part of the agreement, Article 2 of the agreement specifically says that technical regulations, which is what the front-of-pack labeling would be once we have the standard, must not be more trade restrictive than necessary to fulfill a legitimate objective. And what is a legitimate objective? Specifically, the World Trade Organization tells us that protection of human health and safety is a legitimate objective. So what does that mean for us in the context of trying to move ahead with the front-of-pack labeling scheme? And here I want to highlight a really important case that has come out of the WTO, and is really the leading case in this area in terms of that balance between trade and health. And this is the Australia plain packaging case. Yes, in the context of tobacco, but really important jurisprudence, really important lessons based on their interpretation of Article 2 in particular of the TBK agreement. And just very quickly, let me say what is it that case tells us? It tells us that a technical barrier will not be deemed to be more trade restrictive than necessary, which is the bar that we have to cross, if we have a clearly defined public policy objective, because we're in the space of health being a legitimate objective, and we know we have that. I mean, Dr. Hennis spoke to it, Fabio spoke to it in terms of what our health goals are and the evidence that speaks to this being a real problem. It won't be on more trade restrictive than necessary if the contribution of, based on the contribution of the measure to that public health objective. So if we have evidence that can substantiate, and I don't have to, I mean, Fabio has just done it so brilliantly in terms of the powerful performance of the octagonal high-end warning system in terms of those public health goals. And that there are no reasonably available less trade restrictive alternatives. But here I want to stress something that's very important. When we say that there must not be alternatives that are less trade restrictive, it is less trade restrictive that will contribute as effectively as the measure that we are seeking to implement. And what Fabio's evidence very powerfully and vividly makes it clear is that really the only kid on the block, the only system that really performs effectively in terms of those public health goals are the
octagonal system.
Yeah.
Thank you very much, Nicole. So anytime you hear anyone say that the proposed octagonal system is a barrier to trade, tell them you heard it convincingly from Nicole Foster that it is not. It is a myth and should be discarded and never admitted in polite conversation again. The next of our panelists is Dr. Karen Seeley. Dr. Karen Seeley has labored long and hard in this vineyard, and she is president currently of the Trinidad and Tobago Alliance. We speak a lot about the experts, but what Karen is going to tell us about is how will the introduction of the warning labels affect consumers in practical terms when they go to the supermarket? What are the practical implications of these warning labels? Karen?
Thank you, Sir George. Indeed, this is in fact a moment of joy for consumers. We have been educating consumers for a long time about what to eat, what not to eat, how to eat, etc. And here, for the first time, we have a tool that will enable consumers to make the right decision, or make the easy decision, the right decision. So it enables consumers who are coming in. And as it has been said before, when you go to the supermarket or the grocery or the shop at the corner, you are not going to line or to party. You are going to quickly purchase what you have to purchase and get out. It's just seconds that you make that decision. So the information that has been on the back of the package so far has been close to, for consumers, not much use. Now we have it on the front of the package. We have, in addition with this octagonal warning label system, what we have is a simple, effective tool. I almost wanted to say that this octagonal warning system is the best thing since sliced bread. But I think I have to make sure I say it's whole wheat bread or whole grain bread. But it is in fact really, really helpful to consumers. So we come in and we look at the packages and we can first see just by the numbers. You know, if I'm comparing two products very quickly, just by the numbers of octagons on one product compared to the numbers on the other, I can make a choice. And then if the numbers are the same, if they both have 2 or 3, I can then go more closely and see which of the high in, which of the nutrients that are fact in which it is high is bad for my health or bad for my family's health. So it provides a system for us to use. And what is also beautiful about it, it's the simplicity that does not allow you, does not require you to have nutritional knowledge. You don't have to have a degree. You don't have to, the people who understand this see warning signs all over. They see stop signs, they know what that means. This is going to therefore be a system that allows all, regardless of age, regardless of culture, regardless of educational level, everybody can use the system and benefit from it. Because what we want is for the poor as well as the rich to be able to, in fact, decrease their obesity. We know where the obesity, in fact, is more problematic, and that is within the poor. So the fact that it works for them helps us to help the poor to make that choice is, in fact, really an important part of what is happening here. I know that also, I always feel that children are remarkable change agents, and someone else is going to deal with that. But without a doubt, we've already had little studies in Trinidad that show that children pick this up very quickly. And while at first they may, in fact, not be, not be, what should I say? They may object to their parents not purchasing the foods. They themselves quickly become agents to say, okay, all right, this one really has too many warning signs. I think I better go for another product. So the consumer can be confident, right? The consumer can be confident. The consumer has a system. You come in, it's simple, it's effective, it's quick. It does not require me to know the levels. Somebody has done that work for me already. All I need to know, and it tells me it's higher than it should be in sugar, salt, and fats. And that is what makes this system really so remarkable at this time, that in fact it allows us to know that we will make the choice. And the evidence that we have shows that it allows us to know that we will in fact consume less sugar, and that we will see the obesity decrease over time if we continue to do this in all of the products that are harmful in this way. The ultra-processed food and the processed food we've talked about, those are the ones we focus especially for the children, the so-called snacks. But in fact, there are many processed foods that are high in sugar, high in fat, and high in salt. This makes it easy for us.
Thank you very much, Karen. I like the idea that it's a great leveler, that this warning system is a great level. It allows all people at all levels and at all ages to be informed and have the necessary knowledge, information to make the right choice. I like that aspect of it. And I hope that our listeners take that away, how important this is for everybody. Now, Alois, who is the UNICEF representative for the Eastern Caribbean area, he spoke initially about children, and we're going to ask him to elaborate a bit more as to the front of package warning label as a tool to facilitate the access of children to nutritious food. That is one aspect we have to stress. Alois? Alois?
Yeah, sorry, I was mute. My mic, I mean. Yeah, thank you, Sir George, for the question. You know, I would even go beyond the right to nutritious food, because I would go beyond than that. And let me make reference to an international instrument that all states in the world, and first and foremost, Caribbean states are party of, they are signatory, I mean the Convention on the Rights of the Child. Every child, everywhere, at any time, has the right to survive, to develop, to thrive, and develop their full potential and be able to provide for themselves, their families, their communities, and hence contribute to the development of their countries. So then with this issue of unhealthy, food, what it does, it increases the obesity. We have seen the experts have presented that obesity, overweight obesity, leads to diseases, chronic diseases that increase mortality, morbidity, disability, and then of course, the children, Caribbean children, will not anymore enjoy their right to survive, develop, thrive, to develop their full potential. So this is really a serious issue, because when the experts have presented, when we look at the trend, it's really a serious concern. It's actually a crisis. the key duty bearers, starting by the member states, the parties to the Convention of the Rights of the Child, they have to address, they have to turn this situation around and do the right things, meaning that the duty bearers have to create a conducive environment in which children, young people are not exposed to those threats. What does it mean? It means, of course, having the right standards. I think the front of package warning labels is a great step. But it's not enough. It's not enough. They have to ensure that healthy food is affordable, accessible, and it's possible. It's a matter of policy. It's really a matter of policy. Of course, we have to ensure, as part of also the enabling environment, to ensure that there is no marketing promotion of healthy food everywhere in the media, at school. It's unacceptable to have that kind of marketing promotion in schools. So duty bearers, the states, the Ministry of Education, the principals, the teachers, they should protect the children, young people in public settings like this public institution, right? Like schools. It should not be acceptable. So I consider that this is really a critical moment, period for the Caribbean really countries to make the difference, to do the right things, to fulfill their obligation. And of course, it doesn't mean that if the Caricom states take the decision that the implementation would be just overnight. We know that there are some challenges, but that's part of the implementation. That's part of the implementation, and it takes some time. But definitely having a proper and adequate environment for Caribbean children to thrive, and of course reduce this burden of morbidity, mortality, disability is critical. And by the way, I understood from the experts, it's also good for the economy.
I agree. Thank you very much, Dr. Lois. Thank you very much indeed. Now, we turn to Dr. St. John. Dr. St. John, we know that your agency has been a major advocate for a comprehensive approach to address overweight and obesity. Do you want to make any comments on the front of package labeling, warning labels, as a component of those efforts of your organization, or in general?
Yes, thank you. But first, I want to wish everybody happy World Health Day. And I want everybody to see this discussion in the context of building a fairer, healthier world. So there is something called the 6-point policy package, of which food labeling is one of the 6 policy imperatives. Now, what is policy? Policy is the responsibility that is taken by government to provide an enabling environment. And CARFA, under the previous executive director, Dr. James Hospitalis, came up with a 6-point policy package. It involves food labeling that we're discussing today, but also nutrition standards and guidelines for schools and other institutions, nutritional quality of food supply, levels of harmful ingredients should be minimized or eliminated, food marketing, food chain incentives, and trade and fiscal policies. But for me, food labeling is the greatest of all, because it gives persons the ability to make their own choice based on what the ingredients are. And so as part of a continuum, a whole of policies, I think that the food labeling gives people the kind of options to make the right and the healthy choice. And I think that's very powerful. I also wanted to go back to this whole issue of the fact that we have the worst statistics in terms of obesity, not just in older people, but also in children. And I want to talk about something that I learned of when I was first working in the Ministry of Health in Barbados as a senior medical officer of health in the late 1990s. And at that time, in analyzing Barbados' statistics, it was clear that we had a really bad problem with obesity and NCDs. And I have unfortunately lived to see that as bad as it was, it got worse. And we are at a stage where we have to do something different. We can't walk the same walk. We can't talk the same talk. We have to do something different. And the labeling, the front of package labeling, is one of those things that's different. It's not that difficult. If the Caribbean could get together and as one fight COVID-19, I think that we can work, government, private sector, and consumers can work together so that front of package labeling gives everybody the best chance. So in terms of the suite of measures, the other thing that I like about front of package labeling, food labeling, is that with a simple device and effective device that Fabio just presented so well to us, even children can say to their parents, this is a choice to make. I choose this. It's done so simply and so well that even children have that right, the right to a healthier, safer world. The same thing that we are celebrating today. So I like the idea also that we have had Caribbean research to show effectiveness. What we need to do now is to get together, people who think like us and the people who don't think like us, and find the best way forward in the way that the Caribbean has done in dealing with COVID-19. Now, COVID-19 is not going anywhere soon. And those really horrible statistics about the Caribbean just make us all more vulnerable for a longer time, including our children. So let us see if we can really all work together for a safer, healthier world, so that we can reverse something that seems to be coming true in my lifetime. That we may see parents burying children because the children are so unhealthy because of NCDs. Let us see if we can all work together to avoid this. Thank you, Sir George.
Thank you very much. And words of Bob Marley, let's get together and eat all right. Thank you very much indeed. We mentioned children throughout. I want to go back to Dr. Celia again, who spoke of the adults making these. Do you believe that we can have children as change agents, not only adults? I don't know how many children are listening to this, but all the evidence is that children can be change agents. What do you think, Dr. Celia?
Sorry, I definitely believe that children can be change agents. There's nothing more effective than a child saying to a parent, no. That's not what they taught us at school. This has too many octagonal labels, mom or dad. The parent reacts to that information coming from a child, especially when in fact the knowledge has come from a school. It is even more important. So children also influence other children. The peer pressure is real. And if it is that we are working as children and we are working to be cool, eventually, we want to have snacks with as few octagonal signs as possible. It's easy to pick that up with octagonal signs, much easier than any other system that we now have. So the children can monitor themselves, they can help to monitor their families, and they can help to monitor what's happening in schools and with peers of their own age group. So they're really very key.
Yeah. Again, talking about children, Nicole, you presented very powerful arguments. The kinds of arguments you presented, you think they are translatable into some things that children can use as arguments for making the case for there being these front of package warning labels of the type we think are the best. Do you think so?
Yeah, certainly, Sir George. I mean, the linkage is clear to my mind. The linkage is a human rights one. Children understand that. Children understand that, you know, my little 8-year-old is in the house saying, I have human rights. And I'm like, what do you know about human rights? But the point is that the whole trade argument, the whole reason why we have an exception, why a body like the trade, the premier trade organization that you would think would just be about trade, at the end of the day says, no, there are certain instances where certain values trump trade. And in this context, health is one of them. Linked right back into our conception of ourselves as human beings with dignity and worth and purpose and all those things. And I think sometimes our kids understand that more powerfully than we do. And it is in a sense a mindset change that we as parents have to make. I mean, even today is World Health Day, and our youth advocates are doing some important advocacy in terms of a school nutrition policy. And one of the persons was commenting to say, you know, when they were little, they remember being concerned about what they were eating, but the adults in their life were shutting them up. And saying, who do you think you are? You know, you don't get to tell us these things are unhealthy. So I think absolutely they can. And the linkage there is they won't go into the technical aspects of interpreting a trade agreement, but they understand that human rights connection, which is very much part of the trade dialogue.
Dr. St. John, if we're going to put all of this together and we're going to make a case to the powers that be, the heads of government, to the persons like Dr. Jules, for example, what would you suggest be the approach to take to make this labeling, as you point out, labeling is the first among equals labeling. How would you suggest that we move in this direction? Given your experience in terms of COVID, how would you suggest that we move in this direction, Dr. St. John?
I'm not sure that I can apply everything that was done with COVID, but I think one of the most effective points of inflection for COVID-19 was the solidarity of the technical, the ministerial, and the prime ministerial decisions on how to proceed with fighting COVID-19. If we could get a few countries to come together and show that this works, we could even have it as a project for the University of the West Indies, the Masters of Public Health students, to study the effects of introducing front of package labeling on the reduction of the even obesity. I wouldn't go as far as to speak about hypertension and diabetes, but if we could get a cohort study going, then we would have the scientific evidence, the Caribbean scientific evidence, which is so important. And I think also we have to continue the trend of leadership that the Caribbean has shown in fighting chronic diseases. So George, you know well what heads of government can do to sway the whole world. If the Caribbean can show that they can make changes with the front of package labeling coming together, I think that we will have the same scrutiny that the Caribbean is having now in terms of the successes of its policies in fighting COVID-19.
Thanks very much. That's a very interesting concept, and I'd like to follow through a little on that. We know, Dr. Jules pointed out very briefly, that there are other forces in the Caribbean that might not be as enthusiastic, to put it mildly, might not be as enthusiastic as we are, we the converted as we are, about front of package warning labels and the use of octagonal, in spite of the evidence that Fabio presented. Is it possible to mobilize the power of the people? How do you mobilize the power of the people so that those who make decisions feel comfortable in being our allies in running against some of the countervailing arguments that are put in the opposite direction? And that, I think, is a reflection on the point that Sir Trevor made about the new program, how to involve, how to engage more people in making this message their message. And again, I'm going to speak to the people who are listening. It is not just the panel, it is all of those who are listening. We wish to make, as Martin Luther King was said, drum majors for this cause. We would like to make them enthusiastic about the idea that it is their rights that are being infringed, when in fact we do not do what is the right thing. So I'm going to thank the panel very much for their eloquent presentation and their points of view. And I do trust that what they have said will resonate with the 400 people listening, and they will multiply this conversation, not only on World Health Day, but beyond World Health Day, to point out it is our rights that are being infringed upon when we do not have adequate food labeling. Marsha, over to you. Maisha, over to you. And thank you very much to the panel.
Thank you, Sir George, and thank you, panelists. Please keep your mics and video on. We're going to go to a question and answer session. We had many questions. Some of them have been answered already by our panelists in real time. I'm going to pick some that have not been. This first one direct towards Fabio. Will imported foods from developed markets with different standards, for example, the US, the UK, or Canada, have to adhere to the same standards? And will there be a level playing field between regionally manufactured foods and overseas foods?
Thank you, Masha, and thank you, Maya, for the question. Yeah, so yes, all products available for the population of the country or the subregion would, being them domestically produced or imported, they would be subject to the same standards. There's no discrimination of products and different application of a standard or a double standard. It's one standard for every product that is being available for the population. So it doesn't matter if it's domestically produced or imported.
Thanks. Would anyone else like to answer, to add to that? Nicole?
I would like to, but I'm not.
Go ahead, Dr. St. John.
This whole thing about what the Caricom and the international be subjected, I'm not sure if it's an issue of being subjected. I think this is the time for the Caribbean to show leadership in what is right and what is actually life-saving. And I think, therefore, if we show this kind of leadership at this time, that it's going to make more of a difference, because people across the world are almost paralyzed in activities to do with public health and to do with NCDs. So if the Caribbean at this time can show leadership, it will have repercussions that are global. So I really think it's time for the Caribbean, even if there are dissenters, I think we can work with the dissenters. And I think it is time that we can show this leadership. It's not always that people should think that the Caribbean is led by others. The Caribbean leads too.
Maisha, if I could just very quickly jump in there as well. So absolutely agree with Dr. St. John in terms of, us needing to be have the courage to lead sometimes, but just dealing more from a sort of technical perspective in terms of the standard itself and how it would apply in terms of the drafting. Absolutely, from a trade perspective, as I said, one of the lessons we know from applying the agreements is that it has to be non-discriminatory. I mean, you could understand that if I have a measure that exempts products that impact on the public health issue that I'm supposedly concerned about, then that raises issues. So absolutely, we will ensure the idea would be in terms of products, provided that our governments adopt the standard then as a technical regulation, as a mandatory standard, then it means that we would be requiring that products coming into our territory would comply, but equally within our, our products as well would comply, so that we have a level playing field from that point of view. Over.
Okay, thank you, Nicole. So panelists, we have another question, and I encourage anyone to jump in. What can we do to convince the food producing industry that FOPWL or FOPL is an opportunity and not an impediment to them doing business?
I can add something if I may. Or...
Go ahead, Fabio.
So I think two things here. It's really important for us to have clarity. First, that the food industry or the food sector is much more than the food processing and the ultra processing industry, and that's really important because we can expand a lot the recognition that a great part of the food sector will benefit. So I think that's the first point. Get other parts of the food sector engaged as well. And the second thing in terms of the processing and ultra processing industry is that one of the things that we've been mentioned based on the experience from other countries, that once the regulations take place, they rapidly start to adapt their products and portfolios, and some start to try to impede or challenge legally the government. But the ones that do embark on changing their products or changing their portfolio, they become much ahead, not only domestically but internationally. Because if you think that the countries they're now regulating, they have the industry with best competitive position internationally, because they are in a so much more regulated country compared to others. They can easily market in there, or they are prepared to market in their countries. So they are prepared to market much better in any other country. So if your country is deregulated, you're going to have much more difficult to exist in the international market, because the international market is going to become more and more regulated. So the earlier you regulate your country, the better is for the industry, and in its best position, it will be placing the industry also in a better position to compete internationally.
I think in terms of the food sector, we ought to remind the private sector that in fact, in 2011, the governments of the world included the private sector in that first political declaration and called on them to be part of the solution and identified ways in which this can happen. So I think we need to take them back to that and remind them that this is a continuation of that. And this particular, as Joy said, this particular policy is one that affects all of their customers. Right? If it is easier for me to buy healthier foods, and I know that healthier foods are better for my children in particular, I will buy more of that healthy food. And if the food sector reformulates towards those healthy standards, they in fact will benefit in the long term. In terms of the cost, it's I understand from the Canadian Parliament that it's what, 2% of the costs that are spread over products that are passed on, and that is manageable. It is doable. It has been done in other sectors as well. So I think it is encouraging the private sector and all our consumers to know what is the best system in terms of the evidence. And I think we should remind people that with respect to public health in the Caribbean, governments have always gone with the evidence. Even in terms of, I'm thinking of immunization, when we led with measles, we undertook the studies to show that MMR was worth it. And we went forward and then others followed, right? So this is the leadership that we're talking about. And this is what we have to urge, that we continue that path. The governments act and do what is right, and in fact, bring the private sector along.
So I am not going down the path of what is right this time. This time I'm talking about what makes business sense. All of this focus on health because of COVID-19 means that people who are health conscious and want to purchase food which is healthy and tastes good, that's not going to be a niche market. That is going to be the market. Other thing is that the very employees of those who produce products or import products that are not healthy are themselves unhealthy. There was an initiative in Barbados when I was CMO there, not government initiated, private sector initiated, where the employees were taught how to eat more healthily, and they were given time by their employers to exercise. And the productivity of the companies improved. We have a lot of presenteeism. They're there, but they can't work. And it is not all bad mind. Sometimes it's just bad diabetes, bad hypertension.
Out of control.
So I think that from a business perspective, we can't hold back this tide of NCDs, which also supports the tide of COVID-19, by doing things the old way. We have to look at the healthy way.
Thank you, Dr. St. John. Thank you, panelists. We're going to have to wrap up the Q&A session now so that we finish on time. We have a number of questions that we will answer. We will respond to you. So thank you for your questions. Do not worry, we will respond to them. I'm going to now invite Sir Trevor Hassell to provide closing remarks. Sir Trevor.
Yeah, so thanks very much, Maisha. Just a few closing comments. So first of all, my thanks to PAHO and the OECS Commission and Unicef for joining with HCC in hosting today's webinar and being actively engaged in the campaign. A further thanks to Fabio of PAHO for his really compelling evidence-based presentation, and to the panelists, and to Sir George, and to you, Maisha, for your really significant contributions to this really very informative webinar. You know, the evidence as presented by the speakers indicates that the octagonal warning labels are key policy tools of a comprehensive approach to NCDs. And the HCC will continue to advocate in this regard. But this then brings me to three issues that have emerged over the last 3 years as we have, and so others have been dialoguing and discussing and conversing on this issue. And the first is perhaps that during the process, as I said, of determining the appropriate labeling standard, quite frankly, to my own surprise, the technical authority and credibility of PAHO and its ability to give public health advice based on the most rigorous scientific evidence has been questioned. This is in fact unfortunate, for since its inception, PAHO has been a major and a universally recognized regional technical resource in all public health matters, providing, as many who are on this call recognize, technical advice and support of the highest scientific level to the Caribbean and to member countries. The second issue, that's one in which many of us have been having discussions and conversations that has surfaced, may best be advanced in the form of a question. And it is whether or not CROSQ and the process of CROSQ, which after all is the regional center for promoting efficiency and competitive production in goods and services through the process of standardization and the verification of quality, whether CROSQ and the process is best placed to lead a determination of a labeling standard that has tremendous public health implications. The third issue that we've been discussing has arisen as to the appropriateness or otherwise of the private business sector being directly involved in policy making around a public health issue in a situation of potential conflict of interest. These three issues, I submit, are issues that should form a part of the ongoing conversation going forward. And so as we reflect and as we seek the best health outcome in the determination of the anticipated labeling standards of prepackaged foods, the HCC will continue to encourage all of our stakeholders, will continue to build a groundswell of support from consumers in support of the octagonal front of package warning labels. For in the final analysis, that's been said by so many, the people of the Caribbean have a right to know what is in the food that we eat. With those few comments, once again, I'd like to thank everyone for taking part. I'd like to thank those many persons who registered to take part and to attend this webinar. And I'll return the mic to Maisha in the event that she wishes to make any final comment. Thank you.
Thank you, Sir Trevor, and thank you to all of the panelists and our partners. I'll invite you all to turn your cameras on as we say goodbye to everyone who participated and attended. Just to note that the voting is open until May 31st. We encourage each and every one of you to reach out to your local bureaus and to become involved and let them know that you support the octagonal front of package warning labels as an important and critical policy measure for the health of Caribbean people. Thank you very much.